Good evening. Hello, everyone. My name is Dr. Sarah Harith, a junior doctor, graduated in 2023 from University of Baghdad College of Medicine. And today I'll be moderator of this session. The Capacity Building in Medical Education course, which is by the RCP Iraq London Network, presented by the Medical Education Committee 2024. And in this program designed to enhance the skills and knowledge of medical educators in 4 Iraqi medical colleges, Wasit, Al-Amid, Al-Kafir, and Sulaimani. The aim of the course is to establish TOT group of medical education in 4 medical colleges. The target audience are the faculty members from 4 medical colleges as seniors and juniors, and medical students interested in medical education. The electronic platform is Moodle. And today we'll start the module 5, which is monitoring, evaluation, and feedback. And of course, it's important to learn what the objective of this module. And by the end of this module, the attendees will be able to apply the monitoring and evaluation methodologies in medical education to ensure the quality and effectiveness of teaching programs and to facilitate continuous improvement in training healthcare professionals. And of course, just to remind you that the requirement for successful completion of this course is to attend at least 5 modules out of 6, and to participate in the pre-test, post-test, and to participate in discussion forums in the module in each module, and also the completion of the assignments of each module. And today we'll have Dr. Omar Mustafa. Dr. Omar Mustafa is a consultant physician in diabetes and general internal medicine based at King's College Hospital. The subspecialties he has subspecialties in complex diabetes, inpatient diabetes. He is honorary clinical senior lecturer at King's College London and site lead for the quality improvement and evidence-based practice module. He is also associate director of medical education simulation lead in King's College Hospital. He is training program director in endocrinology and diabetes, South London, and NHS England Education South London. He is vice president in the RCP Global, RCP London. And Dr. Omar interests include health professions, medical education, and digital health. This is for today's session. Dr. Omar will be our presenter. And for tomorrow, Dr. Naila will be the second presenter. And sorry. Yes, and just to tell you about the timeline, we will have my colleagues in the medical education subgroup will post in the chat box the registration form. You have to fill it, and also Dr. Omar Mustafa will be presenting for monitoring and evaluation of medical curriculum for 45 minutes. Then we will have questions for 15 minutes, break for 10 minutes, then back again with the second session, 45 minutes with question and answer for 15 minutes. And to establish ground rules, you have to mute your phones, you have to unmute your speakers. If you have any comment or our question, you can write in the chat box. You can raise your hand if you have any question or comment. And I'd like to say that there's a quote from Leonardo da Vinci that says, "Learning never exhausts the mind." I think this implies to the deep learning and the real learning, which is, of course, Dr. Omar Mustafa is the best in it. So let's enjoy this learning experience and grab your favorite drink, and let's enjoy this learning session. Dr. Omar Mustafa, the mic is yours.
Thank you very much. I'll just get my screen sharing and see if this works. Okay. Shukran jazilan ala da'wa. Thank you very much for the invite, for the introduction and kind invite. I'll be going through monitoring and evaluation. I'll touch on quality and a number of other principles hopefully you can take to your current practices to apply. So the objectives I was given, as you can see here, covering curriculum effectiveness, students' learning, alignment with institutional goals, informing curriculum development, faculty development, and how that supports accreditation by regulatory bodies. Encompassing all of that, the keyword here is really, how do you apply the standards of accreditation quality to your organization? Now, when it comes to thinking about organizational approach to things, you need to think of it from two different perspectives, from a transactional point of view, but also from a holistic system approach. Otherwise, it gets, you may lose perspective. And it's important to recognize where you are in that journey, whether you're on the delivery side, planning, or evaluation side. I'll touch on some of the principles in here as I go along. So, first of all, let's get definitions right, because sometimes if we don't get the definitions right, there's a lot of confusion and different perceptions. First of all is standards, and I'm going to use standard way of looking at this, pardon the pun. It's from the Oxford English Dictionary. There are other dictionaries available. So a standard is what is accepted as a norm that is being customary, usual, widely used, or set somewhere, be it local, regional, national, or international. When it comes to accreditation, it's in a nutshell, it's about official recognition by a body that has that official recognition and the official designation. And you'll see why that is important. Now, in some instances, you could be the one who set the standard and start the process towards accreditation. And I'll come to that when I talk about the standards for accreditation. Audit, it's a statement of where we are. Roughly, it's a statement of account. It gives you an idea where the current position is. It doesn't give you anything else. You compare it to a standard, you compare it to your status quo to a standard, and that's where you are. It's very different to research. Research is a systematic investigation or driven by inquiry, aiming to generate something new, whether it's new knowledge, new skills, new way of solving problems, etc. And that brings me to quality and improvement. And when it comes to those two terms, quality is how excellent something is. And it needs to be recognized that improvement is an act of making something better. If you keep doing the same thing, you'll never get better, because standards change, needs change, population needs evolve, and therefore we must always engage in that process. A term you may see in literature, in books, is about how do you implement new things in a scientific way, and that's called implementation or improvement science. And that's how you want to do things systematically, akin to research. So it's a research methodologies of how you want to implement things, because if you look at the standard methodologies for quality improvement and audit, there are methodologies, but there are ways to make that more evidence-based and driven by a systematic inquiry. And if I want to plot that on a graph to make it easier to think about, audit gives you where things are. Now, an audit could form a first cycle of quality improvement. Research is trying to answer this, what new knowledge can we discover? And the gap in between is filled by quality improvement. Now, when we think about that, we should always consider that not just doing these things, we need to think about how can we make things better. Think about enablers, what can drive your whatever you do, whether it's audit, QI, monitoring, evaluation, research, but also the barriers, and how do you learn from those as part of your cycles of learning. I'll bring it to accreditation and evaluation. And if we think about medical education and health profession educations as a wider angle to this, you need to think about the differences between accreditation, program evaluation, but also research in health professions education. And you can see the differences here if we think about it from a mandate, purpose, funding, or methodologies point of view. It's a nuanced conversation, and it's important to distinguish what you are trying to achieve here. And if we focus on the program evaluation, it gives accountability to decision makers about the improvement work or implementation work that's being done, and trying to evaluate how the local context may impact the implementation of a program or a new methodology, or whatever you're trying to do. More importantly, looking at outcomes. Are you delivering on whatever let's say you've introduced a new curriculum, or you're looking at curriculum revision, new assessment methods. Are they really delivering the graduate outcomes you're expecting? Very important, because otherwise you won't be able to get the accreditation. And of course, funding is variable depending on who funds it, whether it's government or other bodies. And you can start to see that program evaluation can evolve into a form part of that accreditation, and part of the accreditation process is a self-evaluation. Now, other bodies may commission other external bodies to come and do an external evaluation, and there are varieties of ways of doing it. Research is different. Research takes into account something you're doing now. You have a new problem or new challenges, and you're trying to get something new to generate more scholarship advancement in the field. Now, for all of these three things, you may see them published in medical journals. So the article I'm quoting this from is about accreditation and how that evolves in the 21st century. You may see program evaluations, new methods, but research, you may see new things being published. So not everything published means it is research, and we need to make that importantly clear. I touched on about thinking. When it comes to looking at introducing things or addressing problems, there are different ways of looking at it, different perspectives. So there's the design thinking methods, where you look at solution oriented, it's user focused, it focuses the thing onto a set of problems, where it was trying to think of a system thinking, like national recognition of a body to accredit medical schools in Iraq. That is system thinking, because you're introducing new thing that will govern the dynamics within an ecosystem that is medical schools in Iraq, for example. And there are varieties of ways of looking at this. Now, you could have the system and design thinking within each of your organizations. So it's not necessarily countrywide. It could be even within a single department. Why bother with accreditation, someone may ask? Well, it's an international standard of recognition. It's a benchmark for your organization within the country. It's a unique opportunity for coordinated improvement and innovation, and I'll come to how this is done. It's not a tick box exercise. Yes, there are forms and ways of completing data collection, etc., but it's not a tick box exercise. It's an opportunity to excel and demonstrate what you have done as an organization, as a department, as a group of individuals. Of course, evidence and science evolves all the time. So where we are now will be very different in 20 years' time. Where we are now is very different to 20 years ago. And this will continue to evolve and change. So what we teach, what we provide for learning will be very different. So nothing stays the same. Of course, medical schools in Iraq, numbers-wise, evolved over time, and as you can see, tracking the population. But of course, looking at this from a quantity perspective, but looking at it from a quality perspective, is important to recognize what is this generating. What are the quality indicators of graduate outcomes? How is this changing population needs, addressing population needs? One indicator of how things evolving, of course, as I said, medical education evolves in Iraq, and many new methods of education, ways of thinking, etc. But of course, some methods, as you can see here, have stayed for a long time. This is thinking about it from a mechanics perspective, but of course, ultimately, you need to think about what are we producing as a body, as a medical school, as an educational institution in terms of graduate outcomes. Globally, there is huge change that happens all the time, moving away. For example, in the early 1900s, there was a lot of science-based, scientific curriculum, subjects-based, evolving into solving problems. Now thinking, you see literature a lot about system-based thinking, competency-driven, how different members of the team interact. So not necessarily just what doctors know, but how they interact with nurses, with dietitians, with other healthcare professionals. Focusing on the patient. We must always remember, whatever we do in medical education organizations and colleges and universities, it must always focus on what the populations need. And something that might work for one set of population in one country may not work in another country. And therefore, the learning, the needs assessment need to be generated from that population you're studying or you're trying to serve, utilizing what's new and what's up to date and implemented properly. Accreditation in Iraq, it's we have a major milestone earlier this year, with the recognition by the World Federation of Medical Education for the National Council of Accreditation of Medical Colleges for 10 years. That's a standard, happens globally, and it gets renewed. And that body, the NCAMC, is the accrediting body for medical schools in Iraq. And Hilal and colleagues are the leaders in that field. Standards. So of course we have the global standards, last updated in 2020. There is the Iraqi standards, which continually evolve. There are, if you look on the website, the 2018 of course is there, but there are multiple new guides looking at quality improvement and assurance, etc. Now again, these are standards, these are guides. The local context is important of the population needs. They're not a curriculum. The curriculum is a tool you use to train medical students to become doctors, and it's a tool that comes out of those standards, and a method, so we say. I keep stressing about outcomes because it's really important. You may have the most wonderful curriculum and teaching method in the world, but if it doesn't generate the graduates that the country needs or the locality needs, it is of no use. So bear that in mind, that really the whole process needs to be integrated and enmeshed to generate that learning, to generate that real graduate outcomes. And what are we generating here? And if we're looking at accreditation as standards, from an undergraduate perspective, it really ought to be viewed as a point, as a stop in a journey of learning. Now, if we on the left here, you'll have the secondary schools all the way down to primary schools as a point in that learning. And from a medical education perspective, there are a number of points that needs to be considered when looking at the standards of medical education, all the way from starting from the mission and values, what are you trying to achieve for the population needs. Curriculum, as I said, as a tool, how it's assessed, how you look after the students, how they're selected, etc., standards for academic staff, educational resources, and most importantly, sits quality assurance and governance of that. And then, of course, that mustn't be the end of education. Education is a continuous learning. And if we look at postgraduate medical education, you'll go through the same process. But the difference between basic and postgraduate medical education, of course, is you have people working as doctors, specializing, subspecializing, doing other things. So how you train those is going to be slightly different, but again, focusing on the learning and outcomes. I was involved recently in the last 4 years in the delivery, in the design of the postgraduate education curriculum for endocrinology in the UK, and we had a number of workshops. We had to look at standards. We had to look at things set by a central body within the UK, and that's what was implemented in 2022. We had to follow those steps all the way, and there is now a process of quality improvement looking at what was implemented. Did it align to the missions and value? Did it not? So getting curriculum is one step, but looking at it from all of these angles is quite important, and that's where national bodies work and bring the collaborations of all the centres delivering this postgraduate education. Of course, that curriculum was part of a national transformation of the curricula that were designed in 2010 and the years before that. So it's a continuous process using, for example, for postgraduate education, introduce the new things around competencies in practice or capabilities in practice, as it's labeled in the UK, based on what's new in the medical literature around entrustable professional activities, or EPAs, if you read North American literature. Now, of course, in addition to basic and postgraduate education, you'll always have continuous professional development. Learning never stops. So when one finishes postgraduate medical education and get, let's say in the UK, we get certificate of completion of training, internal medicine and endocrinology, the learning doesn't stop, because you really need to think about, oh, well, what can I do to keep my learning going? Again, because clinical practice evolves all the time. And we're looking at the same things. Again, it's about missions, outcomes, learning ways, methods. How do we make sure that whatever we deliver sets, but providers may be different, and how this feeds into revalidation and continuous your license to practice. So it's a spectrum. Undergraduate education is one stop. And accreditation brings all this together. Say you do have the it's a continuous process. It looks at all things in an interlinked way, rather than a islands of implementation. This is from the guide for accreditation of medical colleges in Iraq. The steps whereby look at things. So I talked about evaluation. There is self-evaluation, as you can see here, which is absolutely the first step, in the same way as you would assess your learning and assess your learning needs. And as an organization, you ought to go through that, all the way down to how the council looks at the forms, the processes, the procedures. So it goes all the way from, again, going back to the previous slide, it goes all the way from missions. Is everything aligned? Is your curriculum fine? Is the delivery of the curriculum fine? And I would always use the principles of work as imagined versus work as done, because you may have the most amazing facilities, the best in the world in terms of curriculum, staff, and everything else. But, for example, not generating the outcomes in terms of graduate outcomes. So that's where evaluation will start to get deeper into these matters. And accreditation is an important way. Now, of course, accreditation doesn't happen every year. And we have to remember, how do you, as an organization, keep on top of this thing? Now, some may argue, well, actually, I'll just have my accreditation and get on with it and worry about it when it comes. this is an easy option, but fraught with challenges. It needs to be a continuous process happening all the way from grassroots, from how you deliver education at the grassroots level, monitored at modules, committee level, medical education committee, medical education unit within your organization, being discussed and revised on a regular basis, all the way to having an annual point of assessment so that it acts as an annual check of how you're doing using this process, and that feeds into your accreditation going forward. And therefore, looking at that, you'll need a standard, you need a QI, cross improvement, measured quality assurance, and then you need the right environment and resources. Looking at a standard, this is taken from the international standards, but they mirror the Iraqi standards available. And as you can see, there are very clear standards of what you really ought to be looking at and monitoring, starting from all the way from mission to governance. Self-explanatory when you read it, and it's a team sport. It is not an individual sport. So how that's organized within each of your organization is key. A QI method. So let's say you wanted to look at students, how education is delivered and what do they think about it. That needs a way of looking at it systematically. Now, that may not exist, but as part of the standard, you do need that. So this is a quality improvement method that forms part of your quality assurance and evaluation. And it's important to use some methods, choose one. This is one method used widely in the clinical world. It comes from the Institute of Health Improvement in the US, and has been modified and used in varieties of ways. And it sets standards of how you want to look at this. So at the heart of this, it's the plan, do, study, act method. And it's important to distinguish quality assurance from continuous quality improvement. Quality assurance wants to make sure that you're achieving the minimum standards, whereas quality improvement wants to push you forward. Now, as part of accreditation, it gives you that tick that things are fine, you're fulfilling these standards. What you really ought to be doing is pushing that up, getting that higher and higher standards, and making sure that you're not causing harm by doing any of this. So it's important to distinguish these two, and I'll go through the quality improvement in a bit. So this is one standard from the teacher and student feedback, and it mandates that you must have a systematic way of looking at student feedback. There's no good designing something that delivers education and training and learning experience without knowing how the learner is learning. Now, you may be already collating that feedback, how systematic that is, how you're doing this, etc. What standards are you using? Is it just generating some data points and you have no idea where that sits? So a lot of us collect many data points, but actually we don't connect the dots. And by making sure you're using your data points, it's important to generate that insight and impact from that. And I go back to that model. So you're sitting somewhere between making sure you're doing fine or pushing the boundaries to get this better. Always think smart. So you may want to start small and expand rather than trying to do major transformations. So going back to design thinking and system thinking, you may want to start based on, you have the system which mandates change and how you do things, and start to design something that works to fulfill that standard. So for example, in terms of the feedback, choosing a set of questions and trying to implement a simple survey is step one. You can set a reasonable object time period, because it's important to do that. So this is an example of, for example, of how could that be done. You have your set of questions and a feedback form. How many modules are adopting it within your curriculum delivery? You've developed the questions, then you start to develop that, go through that PDSA cycle of auditing where you are, how many are using this, have you implemented it, not, moving from one module to another module, etc. At the heart of this is co-design. So it's not good just designing it as educators. You may want to involve some of the students in the design because they are the ones who are going to use this tool. So co-design is key here, making sure that all stakeholders are involved, and then evaluate what are barriers. And if you find something good and if it works, write it down, publish it somewhere so you can cite it. You can evolve from that point. And when you're looking at evaluation and improving the quality, you ought to be looking at either process or outcomes, or both. Preferably look at outcomes and then think about the process. Balancing measures is where, as a result of any change you introduce, there will be consequences, unintended consequences, and what measures are you intending to use to mitigate for those balancing measures. This is an example of a run chart. When you feed your data, for example, things are good, many modules are going up, and then you achieved about 8 or 9 modules within medical school. Keep going up, but then as you continually audit your cycles, you find that things are dropping and not many feedback questionnaires are being sent, and some modules just dropped it. So again, monitoring the progress is important for the sustainability of any intervention you do anywhere. So monitoring the value being measured across time is key. Quite often we do the bit and then it ends, the evaluation ends, and then you have no idea where you are. Which brings me to what I was saying about making sure that you're measuring things as you go along, because the task for accreditation becomes easier when you're trying to collect the data, which will give you an overall holistic view of your progress in accreditation. Or as like a dashboard. If you look at it as a dashboard every year, then that makes it easier for you when it comes to the point of evaluation. Anything successful, any new things, any barriers you've identified that you've overcome, please write it down, publish it, disseminate it, talk about it, bring people together, have a conference, have a meeting, bring groups together, create that network of learning, because a single medical school cannot achieve everything, and you may want to learn from someone else. And that's how you advance quality across the patch. Of course, for anything, you need environment, resources, and the right network, which brings me to what I was talking about earlier about how do you cultivate that sense of quality and development within your practice. So concept of communities of practice is there. Iraq Network is a perfect example of that from the RC, Royal College of Physicians. It's a good example of community of practice that brought people together towards a common goal using communal resources. And there's plenty of opportunities to collaborate and learn across in that. And if you plot all of this together, where does evaluation and monitoring and quality sit? Sits in a continuous cycle of evolving standards, continuous quality improvement, always focusing on graduate outcomes, healthy population, and high quality of care. That must always be the goal. That's your outcomes, rather than just focusing on the process. Process is important. And then, of course, you'll have cycles of medical college accreditation. And then, as a council, there is also a cycle of international recognition for that, because they also have to fulfill certain standards to get the continuous recognition. So it's an interlinked process, starting all the way from how education and learning is delivered all the way up to accreditation and learning. So accreditation and the international recognition of the Accreditation Council is a milestone in the history of medical education in Iraq. We must always focus on graduate outcomes and then build a process around that. The undergraduate education is part of an ecosystem. It's a stop in a journey of learning. Think about how you deliver that as a value-based education in a sustainable way. Thank you.
Yes, thank you very much, Professor Omar Mustafa. And now, if you have any questions, you can write in the chat box or you can raise your hand. Dr. Ahmed Al-Ibrahimi, you can unmute your mic, please.
السلام عليكم جميعا. الصوت واضح إن شاء الله.
نعم واضح.
Okay, thank you. Thank you, Professor Omar, for this very lecture and fruitful presentation. I would like to talk about my experience as a director of quality management in Al-Kafil Hospital. Actually, we need a step before that you are talking about, which called an awareness regarding to the quality management. It is very important because our experience in Iraq with the quality management in hospitals or quality assurance in universities, we need to raise the awareness of all components of the college. I mean, that's the staff, administration, and the student toward the quality management or quality assurance in general. One of the difficulties that I faced in the hospital, which is lack of awareness toward the quality, and this will impact on the commitment of the higher level of administration toward the quality process in general. So I think it is very important to increase the awareness and talking in what we call quality language and improve quality culture in our institutes. So that's my comment on your presentation. Thank you so much.
Thank you.
Thank you very much.
It's important. I mean, awareness is important, but also awareness comes from implementing an action, and that's really what is our role as educators and as part of that process to do. I think the doing is the key here to make sure that we generate something to attract attention as well, and it starts all the way from the grassroots.
Professor Hilal, please, you can unmute your mic.
شكرا جزيلا دكتور عمر, as always very informative and very useful. في بعض الأحيان ومر الوقت there is decline in the English language perception and talking and everything in Iraq, and therefore sometimes some terminologies or some thoughts or some concepts might not reach to the audience in the way that the presenter wants to put it, and therefore we try to make something that is a common belief among all. What Dr. Ahmed was trying to say, I just recall 10 years ago when we started the process of accreditation, where the NCAMC started its work. No one was listening to what we are saying, especially when we are talking about accreditation, and even some of them are rejecting the idea, and even they are not knowing what accreditation means, and some of them trying to translate accreditation as a process of making Iraqi doctors, the high flyers, go outside Iraq, just like that. And therefore, very important point Dr. Ahmed Al-Ibrahimi highlighted is that we need to build the culture of quality improvement and quality assurance. We have to talk about it. We have to have many presentation, workshops, conferences, press release, social media usage, in order to make this concept fits in the mind of the educators, the educational institutes, the teacher, the student, health service provider, policymakers, politicians. This is a great need, Omar. Really, I mean that, because if you ask me, there is many things in Iraq, so many things, talking about studying, examination, assessment, doing surgeries, examining cardiology, etc., whatever it is. But what is the quality of that? What is the level? No one can guarantee it. No one knows about it. And therefore, we are focusing on that issue. And thank you for your support. Thank you for your time. I know you are very busy, but you allocate this time for this group of what we call it, the task force for a change at Iraqi Medical School. This is very important. Quality improvement. My simple question, Omar, and you can mix Arabic and English as well, from where we shall start. What is the starting point? We need everything. We need everything. From where shall we start? At least in our medical schools. Thank you very much.
Well, I think the starting point has already been done, where you're already accrediting medical schools. So that's the beginning. It's a step in a journey. I think that different medical schools will have different challenges and different problems. And as you do for the individual learner, where you do learning needs assessment, I think each module, each educational unit, each medical school, each sector would need to do their learning needs, their quality needs, shall we call it, and then identify priorities, and then an exercise in priority setting. Which one is the most important in relation to outcomes generation? Which one is the most important to the viability of the learning process? Which one is the most important for the feedback of students and educators? And then you have your list of projects to get starting, and then forming those groups. And some units may want to focus on a problem in delivery of a single module somewhere, but has a flavor of something. But then you do need to have a focal point or focal points where those units will start to present their findings, present their learning points, and then you close that loop of problem generation, learning needs assessment, the actual studying, learning about it, finding solutions, implementing the solutions, generate learning, close the loop, and move on to the next loop in that matter. So you do need all that loop, and it's not easy, but you do need to start small and scale up. Like let's think about it in tech terms. In tech terms, let's say you're developing a new software. You're not going to generate a new operating system from day one. It's a small step, scale up, and then it continues to go through the iterations, version 1, version 2, version 3, etc. So I think start from learning needs assessment first. خطوة خطوة.
Thank you.
Thank you very much. Professor Nazar, please, you can unmute your mic.
Thank you very much, Dr. Omar, for your nice presentation. I would like to ask where and how to integrate research in the PDS cycles. Can we, or we should depend only on others?
Well, research is very different. So for research, you do need to have the principal investigators who have the vision to think where the new knowledge needs to be generated by collaboration with colleagues in Iraq, in the region, internationally, having the right funding, having the right setup. Then you have the studies, academic studies linked to that, so diplomas, master degrees, PhDs in an accredited organization that actually can deliver this. But again, it comes down to what are you trying to achieve? So the question you're trying to answer in research is, what new knowledge are you intending to do? Again, it goes down to, well, what are the learning needs you've identified that you have no answer to? Now, some of the answers may actually be available from elsewhere, but again, you need to think about how do you adapt them, for example. So you either generate new things that nobody knows and you advance that, or you adapt something that other people have researched and done, or you do a mixture of those two. But again, it's generating new knowledge. So I think needs academic institutions, principal investigators, students.
Okay, yeah. What I want to emphasize: do PDS cycles can generate some sort of new knowledge, or that can be published or distributed?
Yeah, I mean, there are many journals that accept quality improvement as papers. So, and in fact, sometimes in quality improvement, you generate either success stories that you can learn from and implement, but also they can generate how things didn't work. And that's equally as valuable to publish as a new thing, so that someone else reading it going, okay, well, I've tried to implement X, Y, and Z, and actually I faced this, and this, and I couldn't do this. Someone else might go, oh yes, well, I shouldn't do this because we have the same context, we have the same environment. So yeah, anything you do can be published.
Thank you.
Thank you very much. Dr. Zainab Abbas, please, you can unmute your mic.
Good evening. It's Zainab, a medical student from Master University. My university had recently got the accreditation. So I'd like to ask, with our college recently achieving the accreditation, how can we effectively evaluate our freshly graduated doctors to ensure that the education and training provides align with the expected standards and the societal needs? What methods and metrics we need to do or make or plan so we can predict the outcomes, and then how to evaluate our outcomes as the students are moving from the Ministry of Education to the Ministry of Health.
Good question. So there are a number of facets to this, and of course, you'll have to take that in different contexts. So all the assessments should be based on making sure that the people who pass those assessments should align to the outcomes. So the assessment methods, the curriculum should always come from the outcomes. Now, as far as I'm aware, in Iraq, it's still the case that when students pass the final exams in year 6, they gain their MBCHB and they can be certified as doctors. In some countries, there is a national exam that students have to pass in addition to their final exam to get accredited as doctors. So for example, in the USA, they have the USMLE. In the UK, it's coming up, and it's called the UK I think it's UK licensing exam. Can't remember the exact name.
KMLE.
MLA, yes, thank you. And those again will be delivered from the outcome, so you ensure that people who achieve those outcomes pass the exams. And of course, as how this is evaluated in a systematic way, the accreditation process would be evaluating the mechanics of the system, but also how this is generating the outcomes. Now, of course, when students graduate as doctors and they start their postgraduate journeys, there are different outcomes, and however that system is set up, but there are postgraduate outcomes if they are part of a structured training program that they have to fulfill.
Thank you very much. And we have a question in the chat box. Dr. Muhammad As'ad is asking, Dr. Mustafa, in context of no authority is given for medical students regarding admission state, aren't the schools, after accepting those students, accountable socially and ethically for making them well-rounded doctors rather than filtering them and trying their hard to minimize the numbers of students in time? They should optimize resources and facilities with up-to-date principles. What's considered the success here? Filtering students or qualifying them in a sustainable and holistic environment? Is it through upscaling our efforts or minimizing our outcomes?
Well, you have your national outcomes, and that's something you can't change unless it has gone through the right consultation process. Of course, there's a national process that's agreed. There's a process for this. It's not subject to what we can do about it. It is something nationally implemented, but of course that could be consulted and changed using the right process. The purpose of studies, let's say undergraduate studies, is to make sure that the students are supported to generate the next generation of physicians, next generation of doctors. Now, some of them will be in difficulty. Some of them may not succeed in that, but as long as you have set up your delivery, your support packages, and your assessment methods in the way that supports the students to be the next generation of doctors, some of them may not be able to finish, and that is sometimes is expected in some systems for people not to pass. But the primary objective of a system must not be to fail the students. The primary objective for an educational system is to equip the student or the learner with the support methods to make them succeed. Now, if there are external factors that make this impossible or a challenge that the students face, we must try our best to make them go away, but not easy.
Of course. Thank you very much. And Dr. Ahmed Ibrahimi, again, you can unmute your mic, please.
Yes, thank you. كلام دكتور عمر يعني صحيح بالنسبة لل focusing on some departments, but in our situation in Iraq, I think we have to build a base. Okay, your work is your words are correct in well-established quality process and institutes. But I think from my experience in hospitals, we need to build a good base for the quality culture, and then move to the smaller projects to get a success story to show others that we have a success in this place and other. لذلك أنا يعني أبقى مصر إنه بناء الأويرنس والكواليتي كلتشر بالمؤسسات هو الفيرست ستيب. من بعدها نمشي خطوة باتجاه إنه أسس قصص نجاح في ديبارتمنتس معينة، نشوف الآخرين يعني إحنا نجحنا بهذا المكان وذاك المكان. لذلك إنه المفروض إنه يكون سعينا بالبداية إنه ننشر مثل ما قال الأستاذ هلال، إنه ننشر الأويرنس. هذا good example بصراحة بموضوع الأكريديتيشن in general and الميديكال education أيضا يعني good story. لو ما كان هنالك بناء لهذه المفاهيم في المؤسسات ما قدرنا يعني ننشئ قصص نجاح في مكانات مختلفة من الجامعات العراقية. شكرا جزيلا.
Yes, thank you very much. Professor Hilal, please, the platform is yours.
And I should stress on one thing. I totally agree with Dr. Ahmed Ibrahimi's suggestions. Dr. Omar, the culture for quality improvement قد تكون معدوم كمفهوم كقناعات كpolicies from higher top down. There is no such a culture, and sometimes building something in where is no base, something it's very, very difficult and fighting. And I give an example about the accreditation and the think about that. But what drives accreditation and push it or promote it forward was the WEFMI deadline for the medical schools by 2023. At that time, for any graduate cannot sit USMLE if his or her medical school is not accredited. That gives a strong push for the accreditation process in Iraq. And therefore, I think the same can be applied for the quality improvement, because now the culture of accrediting hospitals, especially starting with teaching hospitals and going to the other hospitals, probably if that culture being promoted and highlight on that title, probably that accreditation process will help to quality improvement, at least what Dr. Ahmed Ibrahim is trying to say. But nonetheless, we have to start, and there must be a starting point. And at any time you will start, it will be the zero time for you. If you start today, it will be zero time. If you start after 10 years, it will be the zero time. Therefore, I think we have to start. And thank you very much, Omar, for really enjoyable discussion.
Not at all.
Thank you very much. Actually, I think we are reaching the end of the first session. And I would like to say that there is a quote that says, "Al-hilm janin al-waqi'." The dream is the embryo of reality. So I think starting today by small step can change even after like 1,000 years. You can see even after 100 years, of course, the change will happen. And we will have 10 minutes break right now. So at 10 or 7, we can come back again. And please make sure to register in the form posted by my colleagues because it will not be sent in the second session. Thank you very much and see you in 10 minutes.
Thank you.